biggest thing is having some sort of baseline or some sort of starting point. And what I usually teach is kind of identifying maybe two or three things that you can use to tell if your body is in a more guarded state where things are tighter, maybe muscles don't feel like they're engaging properly, maybe you even feel a little bit out of balance or even feel like you're out of alignment, versus when you're in a more or less guarded state and muscles are engaging properly, they're feeling looser. So you need a way to tell. So I'll have my clients kind of identify maybe two or three things that stand out that maybe feel a little bit uncomfortable or tight, and they use those as their baselines. That way they can see what exercises make those things better, what exercises makes those things worse. And maybe some simple ones that you can test are bringing your knee up towards your chest. Does that feel like it pinches? Is that uncomfortable at all? Or maybe even bending forward, like you're going to bend down to touch the floor. How does that feel? Is there any areas that feel tight, tender, sensitive, maybe more on one side than the other? Even doing a body weight squat, you can use that and see, does anything feel asymmetrical, or does anything feel a little bit uncomfortable when I do that? And then these things can become the baseline that you use in getting a before and after effect of certain hip openers, certain lower back exercises, because your body will give you pretty fast feedback and it might be subtle. So you have to do these movement tests in order to assess it. Your body will give you pretty fast feedback on if it's something that maybe is resonating with you versus something that is maybe working against you.
And it could be, I'm assuming, something that could be on your left side, but not your right side, because none of us are equal. I mean, you just look at your face, then not your face, but you look at people's face, it's never equal one side to the other. And we're just built like that naturally. We have different
Right, yeah.
organs on different sides. If women have complications with fertility, for instance, if it's PCOS, they might have more follicles on one side but not the other. Same with endo, it can be wrapped around different areas. So if you do it, you're looking at each different side, not just is it generally okay, going into the detail of it. Yeah.
What I'm kind of understanding is you're saying if like they have, maybe it's more affected on one side, there may be differences on that side. Like if the okay,
Yeah.
um, yeah, I generally tell people to look for relevant asymmetry. So what that means is like we have some differences. Maybe you can't stretch as far on one hip than the other, but it may not be really relevant to discomfort or anything that you're feeling. You just may feel a little bit tighter on that side. That's not always as important as finding things that are more relevant in terms of that cause, maybe more discomfort or maybe feel tighter than usual. But looking for more of those relevant asymmetries, which is, yes, sometimes we do have relevant asymmetries or irrelevant asymmetries here and there.